Hello and welcome to another episode of the Daily Remedy Podcast. Today I want to talk about an issue that we've discussed in the past and have really highlighted as an extremely polarizing issue: abortion. Yes, it's among the many polarizing issues, and I think to single out abortion as the only polarizing issue, as much as we do, kind of does a little bit of injustice to some of the other issues that, in all fairness, deserve more airtime, more media time, what have you. The reason why abortion is so critical is because the issue has voting power. And it's a very important dynamic for we as the public to pay attention to, because abortion is a test case for other issues of healthcare, of health policy in the future. Should it ever gain voting power, how the dynamics between public perception, health care, and health policy play out in the voting booths. Now, the key thing to recognize here is that health policy and health care are often at odds. And what I mean by that is the broad strokes of policy that affect healthcare at large are often made in ways that disenfranchise those who are subject to those healthcare issues and are the most vulnerable. Think about abortion bans. Abortion bans of, let's say, 6 weeks affect those who are of disadvantaged socioeconomic status and have to go farther for abortions or have less means to pay for an abortion. So we can kind of see how the policy and the effects have this counterintuitive nature. I want to play that out in a series of extrapolations by looking at recent polls about abortion and see how that's going to affect healthcare issues at large. All the healthcare polls that I cite will be linked in the references below, so I want to just go through them and then you can highlight the links when you're done to then get a more context of the view. So let's look at the abortion Gallup poll right here. The key thing to look at from the Gallup poll is that while the views of abortion in that it should be legal under any circumstance or legal under certain circumstances remain relatively stagnant, there is a distinct upward trend, meaning more people are pro-choice in America than ever before, but slightly only. The key factor, the key trend to note is that less people are staunchly anti-abortion than they were before. And that is the largest demarcating factor. And what I mean by that is favorability for abortion to be legal in all circumstances, legal in certain circumstances, are on a slight increase. But those who feel like abortion should be illegal in any circumstance, those staunchly pro-life, are decreasing. And that's a key thing to recognize here. And that point's going to come up over and over. Now, that doesn't really affect people's identity in the sense that the same number of people consider themselves pro-choice and pro-life, and that really hasn't changed that much in the polling. Again, a lot of these trends are more noise than anything else. But the key thing to look at, and this is going to be, and I'm going to cite the figure because I think it's really important. It's the one that talks about based on registered voters, and the title is, do you think abortion should be legal under any circumstances, legal only under certain circumstances, or illegal in all circumstances? And the key thing you'll realize again is a slight upward trend in saying that it should be legal under any circumstance, a slight upward trend in legal only under certain circumstances, but a significant decrease, almost 100% drop, meaning from 20 to close to 10, 13%. That's half believe that abortion should be illegal in all circumstances. That means that the general consensus is favoring abortion. Now, how does that play out in the actual voting itself? For that, I want to look at another polling series. This was done by the Kaiser Health Tracking Poll, the KFF Health Tracking Poll done in March of 2024, talking about abortion. And in there, we talk about the same highlighting points where most voters feel like abortion is the most pivotal factor in the issue of this race. Some people may feel like immigration or the border crisis. Again, it's partisan. Those who are Democrat feel like abortion is the major issue. Those who are Republican or more conservative leaning feel like the border is the major issue. But the key thing is that the perceptions of how strongly abortion plays a role in the elections will determine voter turnout. Here's what I mean. Less than half of adults say the right to use contraception is a secured right, which means that they don't feel like a right which they should have, a right which is growing in popularity, they feel is under threat. Now, when you contextualize abortion as a right, you're turning it from a healthcare issue into a fundamental constitutional issue. That gives it voting power. That's the secret sauce behind why abortion has voting power and other health issues don't. Other health policies, may be polarizing to the same extent, don't have voting power because we don't contextualize it as a right. Abortion has been, rightfully or wrongfully, now we can get into the jurisprudence around all of this and wax poetic on the philosophical nature of medical jurisprudence. But the fact remains, only abortion is considered a right. Whether that's a right to access, a right in totality, an absolute, a relative, what have you, it's considered a right. And that's a very powerful philosophical, cognitive framework that takes place in the mind of the American public because now it transcends healthcare. Now it has voting power. And that's the one thing abortion has that other issues don't have. Another key point that was made in the KFF health tracking poll. There is broad support, even among partisans, for protecting access to abortions for patients who are experiencing pregnancy-related emergencies and protecting patients' right to travel to access abortions. Now, here's the critical thing here. They talk about access. They talk about rights. The general sense is that abortion is becoming more acceptable in society and recognized more fundamentally as a right than ever before. But we talked about the favorability, although it's increasing, is slight. But those who are staunchly opposed to abortion, that's going down. And that's a bigger factor. Here's a key point that highlights that from the KFF health tracking poll, which kind of ties together the Gallup and the KFF health tracking poll. And I quote, reflecting strong Trump support, Republicans trust former President Trump on abortion policy, regardless of their own views on the issue. Now, we can talk about Trump hysteria or any of these other kind of terms that relate to the fanaticism that surrounds Trump. He has a loyal following, and to be fair, I don't know if fanaticism is the right term, but I think that there is blind allegiance to a certain extent. But that's important because it means that those who support Trump are anti-abortion don't really have as strong an understanding of the issue as they would if they were in favor of abortion. And that's key because they're not looking at abortion in terms of rights and unsecure rights and what have you. In fact, the difference between the Democrats and the Republicans are so vast in their understanding of abortion as a fundamental right that it can be argued that abortion isn't even seen as the same issue for Republicans as it is Democrats. For Democrats, it's a right. For Republicans, it's simply another Trump-based marching order. Now, here's where the issue is. Now, when it comes to the election, the presidential elections in November of this year, the states that have red-leaning policies on abortion, meaning 6-week bans, meaning less access, meaning more restrictions, more legal threats, those are the states that you will see a greater turnout for abortion. So what's interesting is that in those states where healthcare on abortion is at its lowest, because we know access to abortion increases quality of life, increases outcomes, increases maternal health. So those states that have less outcome, less access, and worse clinical outcomes as it pertains to abortion and those related factors will actually have a stronger headwind on voting. So the policies going against anti-abortion rhetoric will strongly negate the decreasing quality of health care. So again, worse off health care, stronger incentive to change the health policy. You start to see the contradictory nature of health care and health policy. And now you can say it's the nature of reaction and counter-reaction, the dialectic of history as applied to health policy, but that's a fundamental issue that's going to affect this election. Not in the sense that a red state will turn blue or a blue state will turn red, but those states that are on the fences, the Michigans, the Pennsylvanias, the Wisconsins of the world, so long as they see abortion as an unsecured right, as a fundamental right that they should have in accordance with all the other rights in the Bill of Rights, there will be increased turnout. And doesn't matter how popular or unpopular Joe Biden is, doesn't matter how popular or unpopular Donald Trump is, abortion as a right in and of itself has voting power. And the nature of that voting power is this contradictory concept between health policy and health care. So you can see those purple states on the fences between Biden and Trump, red and blue, left and right. Those are the states where you should really start to look at how maternal mortality rates, abortion outcomes, abortion access will affect voter turnout. And you'll start to see those states that have the worst outcomes, those purple states with the worst outcomes, will have the greatest reactionary health policy ethos as played out in the voting ballot. So, for those of you who are prognosticating on the elections and are looking to see how certain states will turn out, if you want to know how those purple states, those swing states will turn out, just look at how bad the maternal mortality is. Just look at how restrictive the abortion policies are. The worse off the maternal mortality, the worse off the abortion access, the more likely it's going to swing blue for Joe Biden. That's the contradictory nature of healthcare and health policy. And we have a beautiful opportunity to see it play out this November. Pay attention.